Hi, everyone. Welcome to our panel discussion on mental health during COVID-19. My name is Alina Janejo, and I'm the president of IPAC USA.
My name is Shafi, and I'm the Director of Public Relations of IPAC USA. Being at home for months and living in a pandemic is something that no one would expect. Everything that COVID-19 has caused has impacted our mental health in some way.
Therefore, it is even more important to take care of our mental health during this period. Today, we would like you guys to share a little bit about your experiences with mental health and learn from others as well. For our panel today, we have Mary Graebner, Samah Shafi, Alia Rizwan, and Shayan Shafi. Mary is a junior at Loyola University Chicago, majoring in neuroscience on the pre-PA track.
Samah is a sophomore at the University of Illinois in Urbana-Champaign, majoring in economics on the pre-dental track. Ali is a junior at East Area High School, and Shayan Shafi is a senior at the Singapore American School. Without further ado, our first question to start us off is, how has COVID specifically impacted your mental health?
Hi, everybody.
Sorry. You can go ahead.
I was just going to say hi, everybody. My name is Samah Shafi. Thank you for being here today. I just want to start off by saying, prior to COVID, a big hobby of mine was going to the gym and remaining active. And now that COVID has happened, I feel like that aspect has been taken away from me. And in the beginning months of COVID, it was difficult. But as COVID progressed, I found myself looking at new outlets to remain active and to kind of stay up to date with keeping track of my mental health and taking care of myself.
Hi, everyone. My name is Shayan Shafi, and I'm really happy to be here today. And if I had to choose one thing that truly affected my mental health due to COVID, it'd be really the social aspect. I think I can speak for all teenagers when we all went through lockdown throughout the first phases of COVID. It's really a different change. Also, without school, all that social interactions are kind of a necessity to remain positive during these times. And losing that was a big change. But I think, throughout calling and everything, like texting, everyone just found a way to surpass that problem. So.
Hey, everyone. First of all, thanks for having me. My name is Rizwan. I go to Easton Area High School. I think we tend to look at the negatives a lot about how COVID has impacted us, but there's also, on the flip side, there's a lot of positives that I found personally that have come out of it too. I think the first time that COVID kind of came around in the March, April time period, it was a pretty busy and stressful time, especially with school and all the other commitments that I had. And COVID kind of going into lockdown, it gave me a sort of outlet to just reorganize myself and kind of to work on myself rather than having to worry about everything else that was going on. But like someone Shayan said, as time went on, that social aspect and that aspect of going out and enjoying the activities that you're normally accustomed to, it starts to hit a little bit harder. And especially coming into now, almost half a year later, when you don't get to enjoy those things that you used to enjoy, like going outside, hanging out with friends, etc., it definitely does hurt a little bit.
Hi, I'm Mary. Thanks for having me. I go to Loyola Chicago, and a big thing that's impacted me that everyone's already kind of talked about is that being an extrovert and liking to study with people is a big change when you're used to kind of going everywhere with people, and especially the social aspect of having to say no to people currently when they're going out and not following the rules. You definitely have to isolate yourself even if you don't want to stay safe for everyone around you and yourself.
Right, so clearly COVID-19 has affected all of us mentally a lot. Do you believe there's an effort being made to discuss the mental challenges that youth are currently facing? And if so, how, whether it's in your schools or et cetera?
Yeah, so I do think that as time passes, there are more and more efforts being made to let individuals feel like there's an outlet for them to go out to talk about their mental health. But one thing that I think a lot of people struggle with is initially opening up about their mental health. I think that's something challenging for everyone, talking about something internal and opening up to somebody else. So while I do think that there's a bunch of different resources out there, I think something can be done to kind of let those individuals feel a little bit more comfortable seeking out for help and kind of getting the help that they need to make sure that they're on top of their mental health and getting healthy each day.
Yeah, kind of like Samah said, it's that initiative process which is kind of difficult for some students to understand. But at least personally in my school, what we have is obviously the counselors to talk to, but also advisories, which is basically a safe haven for like students that I've been with since like freshman year. You keep the same people to just talk about yourself, talk about how everything's going, and it's kind of a good place to, like, if you have any stress or any problems you want to talk about, you know, it's a safe place to talk about it.
I definitely agree. I think awareness has definitely got better, especially in the last couple of years. Like, for example, my own school, they've started doing quarterly assemblies about health and suicide awareness, where every quarter we go into the auditorium and they give us a lecture, and they like guide us to resources we can look to help, like counselors, for example. And I also work with the local mosque, and we do seminar mental health awareness as well. But I think the restrictive factor that's brought up is the fact that there's like this stigma around mental health and mental health problems, that if you have a mental health issue, then you're, for some reason, you have some unnatural sort of, and it definitely affects like people needing to go get help, because it's, in reality, it's a problem that faces at some point in their life, and it should be okay, and it should be encouraged for people to go and seek the help that they need. And I think we can do what we can, especially in our friend groups, to let people know that it's okay to look for help and go to the resources that we've been directed to.
So like going off that point with like our peers, in like a lot of my clubs, like in Doctors Without Borders, or like in my sorority, we have a lot of talks about mental health, and like bring in speakers and bring in people that are able to kind of help us through it. And then we have like open discussions talking about everything going on, because since everybody's basically in the same boat, it's just easy to have conversations with your peers, and like it's more relatable on that aspect. Because in the beginning, like nobody really knew what was going to happen, and now we're kind of like in the middle of it. So it's definitely good to like rely on peers that are going through it with you.
No, and I agree with that. I think it's really important that we start opening up to our peers and our friends and even the guidance counselor, because it's important to show society and like our friends that like we're not alone, we're in this together. And moving on to our third question, what is something that has helped you mentally during the pandemic?
So I would say my number one rule that I've followed throughout the pandemic is creating a routine for myself. I feel like being, a college student, being stuck in my apartment for months on end can get so tedious. And something that kind of gets me out of bed is making sure that, I'm getting up at least 30 minutes before class rather than 5 minutes before class and logging on from my bed. I feel like taking a shower, getting dressed in the clothes that you'd normally go to school in would, it personally kind of helps me set the whole day for myself. It makes me feel motivated, and it keeps me up and working. And something else that I've been doing throughout the pandemic is finding new hobbies. I think social media is a great outlet to look for new hobbies, to find new hobbies, and each day I find myself doing something new, whether that's baking, whether that's doing at-home workouts or something like that. I feel staying active and staying motivated is just so important during this pandemic, because it's very easy to feel trapped.
Yeah, I completely agree with Sama, and I would say, like, I want to elaborate more about what she said about new hobbies, because I think that's what kept me going. Um, Personally, for me, I just wanted to be busy as much as I could. I didn't want to waste any time, so I started new hobbies. I learned how to make music. I started running a lot. I feel like the best part about like maintaining a normal, conscious, was just knowing that I had stuff to do. So
Yeah, I agree with them about making a schedule and a routine. That really helped me a lot, especially in the beginning of the pandemic. But I found my problem and my situation to be kind of the opposite of what Samah said, where it wasn't that I was so busy that it was hard to manage the stuff. It's that I had so much extra time from being locked in the house that I didn't know what to do with all of it. And I found myself wasting my time on stuff that I really shouldn't have done, like sleeping in extra late and like wasting time on the internet when I could have been out and active. And I think starting to make that routine and adding it on with new interests and new hobbies that I kind of developed along the way really like starts to get the ball rolling. And then you start adding more and more onto your schedule, and it just makes you feel not even like motivated but purposeful too, like you're actually making something out of the time that you're given, and it's a really rewarding feeling.
Yeah, in the beginning of the pandemic, I just like poured my whole self into studying and just kind of did that for like the whole time. And after a while, it was just really intense. So I found like little things to do during the day, like I found like new recipes or baking or things like that that like I wouldn't normally do. Like if I were to go out to a restaurant that I really like, instead of going to that restaurant, I'd make the recipe at home and like try to make it my own. So just kind of like finding little things to add in through the day to like make yourself excited to get up was a big motivator.
Yeah, I definitely agree. I think it's important to set a routine and also connect with others. And I think we've certainly felt that friends and family members have become an important part of the coping strategy while going through this pandemic. So how did you guys ensure that you're connected to them despite like the social distancing and stay-at-home orders?
Oh, sorry about that. Yeah, so something that I think Ali mentioned this earlier, we're so busy focused on the negatives about the pandemic, but something positive that happened was, being able to have that time with my family. My brothers went to college when I was in sixth grade, and then I also just went to college last year. So that family time was kind of taken away from me. And I feel like being at home with my brothers, with my family, was just so much fun because we hadn't had that family time in so long. Um, and then something to add on to that is that, once we go to college, I feel like the only time we get with our family is over big breaks or something like that. It's almost like as soon as you go, you're gone. So this pandemic almost gave me 6 more extra months that I would have never had with my family. And then on top of that, I also live very close to Shanur, actually. So um, I was able to visit her a few times, because we'd both been quarantining, we'd both been social distancing. Um, so I think being able to have that extra quality time with my family has been such a fun experience for me. And it's been something that I'm so grateful for, because I know that if it was any other way, those are 6 months that I would have never had.
Yeah, I think during these 6 months, I it's definitely been like my family and I have gotten a lot closer. Like we've been having game nights to keep up, just with the time, and we've been bonding. We go biking a lot now. I think it's definitely just a new change for the better because beforehand, everyone would be locked in the room doing their own thing. But because of COVID, now we've kind of made it a routine. As Singapore's doing pretty good right now and things are opening up, it's still a routine to, maintain that family time because of what we built during COVID. So I think that was a really good sign or a good plus to it.
Yeah, I totally agree. I think one thing that we mentioned earlier about how we kind of lost that social interaction with our friends because of the pandemic, we can or I kind of made up for it with my family and family connections. Like instead of doing something that I would normally do with my friends, for example, I could do that with my family now that I was locked in with them anyway. And it brings you closer than like Shayan. It's really rewarding to be able to get to know the people that you're supposedly spending like your whole life with or your days with, and it's really you show a lot of gratitude in the process.
Yeah, like going off of that, like me and my mom went on a lot of walks and would spend a lot of time together and like make a bunch of recipes that we haven't made in a long time and things like that. And also when I had to study, I would make just like a bunch of Zoom calls and have a lot of study groups. Like I study with Alina with genetics and just like things like that to kind of like keep you sane. A lot of Zoom calls and definitely like a lot of nights with my mom was really awesome.
And I agree with all of you in the fact that over quarantine and during a pandemic, we gotta connect with our family a lot too. And moving on to the next question. Social media is everyone's companion now. What role has social media played in our lives during this pandemic, specifically in context to alleviating the anxiety you're feeling it?
So I think social media is, it can be a controversial issue to talk about just because I feel like spending too much time on social media also has its negative impacts. But personally for me, as I mentioned earlier, I have been able to find so many new hobbies on social media. Like prior to the pandemic, I never used to bake as much. I never used to cook as much. And, you know, the pandemic has almost forced me to look for new recipes, find new things to bake. And on top of that, I feel like social media has just let me kind of relax after the whole day has gone by, after keeping myself busy. It's a nice outlet to just go to kill some time and to kind of alleviate that stress that I've had throughout the day.
Yeah, I think social media, obviously there's that thing that's like the negative aspect of it is the people staring at it, watching the like count they get for their posts. You know, that's obviously I guess what can cause anxiety or like the bad parts of social media. But I think during this pandemic, social media was a really positive thing because it allowed you to communicate with your friends that you couldn't meet, especially like during the early phases when there was for us it's called phase one, where you just could not see anyone, lockdown basically. The only way to keep in contact was through social media. So honestly, if anything, it brought anxiety down personally because I knew like after I finished my work in school, like online school, then I can go and hop on social media, like, you know, FaceTime, Instagram, something like that, just call my friends. So yeah.
Yeah, I also think social media had a lot of positive aspects, especially when the pandemic came around, like being able to connect with people more and finding new interests and stuff. But I also think it got pretty dangerous, especially because personally, I was seeing a lot of large influencers and even friends posting stuff about the gatherings they're participating in and the environment that, or this false sense of what a pandemic life should really look like. And it kind of creates this sense like in the people that are being influenced by that, where when they see people like gathering and doing like pre-COVID activities where it's like, why can't I do that right now? And it's kind of unfair, or it's maybe even frustrating for some people. And then it gets even more dangerous when people get influenced by that. Like I was talking to a couple of friends recently who they said that they saw someone like a really famous person doing some activity with a large group of people, and they went and they did that same thing. And they said that the reason they did that was because of what they saw on social media. So in that aspect, it can get pretty dangerous with influencing people to do the wrong things and make the wrong choices during a pandemic.
Yeah, I think going off of Ali, it's definitely like it's just kind of almost depends on like who you're following or like what kind of content you're looking at, because it is good to like find recipes and things like that. But also like people do like to post their highlights of their life on social media, and sometimes when you're feeling down in the pandemic and you're like, well, what am I supposed to do with my life? Like we're all locked in, and you're just seeing people post all these like throwbacks of them like living their life. It can make you feel a little bit more depressed. So it definitely depends on the content that you're looking at, and like what kind of apps you're using. Like for example, like I'll go on TikTok and just like send random funny things I find in my friends, and then it'll uplift me, and then I'll go on Instagram or someone's like posting this like extravagant vacation they went on, and then that makes me sad. So it kind of just depends on like what content you're looking at.
Right, I agree. Personally, I just transferred to Northwestern University, and so social media has been a way that I've been using to connect with people who are also transfers, and find a community that way. But I also think, on the other hand, social media has this possibility of making us unproductive, almost like Alia was mentioning earlier. And so we have to be mindful of that and make sure to take a break away from it. So I think I've definitely been aware of how much and how often I use social media, and then make sure to take a break off of that. Going off of that, do you see mental health differently compared to pre-COVID-19 to present day where the pandemic is still going on? Has the pandemic changed your perspective on how mental health is viewed?
So personally, I always prioritize my mental health just because I feel like it's arguably the biggest contributor to your well-being. I think that that initial waking up, setting that day for yourself, making sure that you're motivated, making sure that you're productive, and just making sure that you're feeling good is just so important to you because especially now during the pandemic, it is so easy to just kind of forget about everything and sleep those extra hours and stay up late and kind of that kind of sets the whole next day for you. So yeah, because of the pandemic, I do think of it a little bit differently. I think that it's more important to pay attention to your mental health, just because I feel like um, because of COVID, um, you're forced to get up, make sure that your whole day is productive, um, and I just think it's so important to set that whole scene for yourself.
Yeah, I agree. And for me, I think prior to COVID, the main things that I was witnessing firsthand was in school, high school mental health issues, like such as time management issues, depression, procrastination, kind of the main ones that center around schooling. But when COVID-19 started, I didn't get to witness those firsthand, but instead, I was still taking courses at the time and like psychology as well. And in psychology, we learn a lot about mental illnesses. And I guess after like experiencing the lockdown phase and also learning about countless different mental illnesses, I really could apply that. I could be like, okay, so then actually during this time, then this could happen. Like if you're not seeing people, then you could be like I learned a lot basically. Like, and I guess I self-taught it, and it really opened my eyes. And so
Yeah, I agree completely with what Shayan's saying about learning more about mental health over the time. I can say that like prior to COVID, I understood that mental health was a pressing issue among especially teenagers, and I knew that it was something that we need to take care of. But I guess I didn't understand the magnitude of it and how dangerous or how important it really is. And then when COVID came around, I finally had a way to relate to everybody else that was experiencing those mental issues, because that's something international. Now everybody's experiencing these things all at once. Everyone has these same emotions of anxiety, sometimes even frustration. And then when you go to talk to, like, for example, with that organization I work with, I had to talk to other people who were facing the same issues, and they came to talk to them about me. I finally had a way to connect to them and to try and help them in a way that I helped myself during that time period.
Yeah, I feel like all throughout like high school and college, like my mom has like always told me to like slow down, and I've like never really understood what that meant because I just was always going and always studying and always kind of just like on the go. And then as soon as COVID hit, like I had to slow down, like she was saying, and it just kind of hit because it's like you're always like with people and you're always doing things, and then as soon as everything slows down, it's like all you in your head, and you just have to really prioritize like internally yourself versus like all the things that you have to do. It's more about like what do you want to do for yourself, and like not anything involving your career or anything, but just involving like your own mental health is like a huge thing to like realize after going from like classes and then like studying. It's just definitely like a huge lifestyle change.
And I think that like obviously I view mental health like much more importantly, because like now after being at home for so long and doing online learning, it's like I haven't got to see my friends, and it's just like I've been at home for so long, and like the studies got to me at one point where it was just like I got loads of homework instead of like learning. I just got way more homework than I expected, and then that just took over me, and like my mental health kind of went down after that. But now, because of that, I view mental health way more importantly. And adding on to the next question, Did any of your friends or family get COVID-19 and had to go under quarantine or isolation? And how did you support them during that period?
Yeah, so I personally don't know anybody that has had to go through isolation or anything like that, but being on a college campus, our numbers are extremely high. And what they're doing for students who are getting COVID is that they're making them isolate in this central area. It's a hotel on our campus, and they're providing them with food and making sure that they're there for the 14 days. I would say that if you do know somebody who is forced to go through isolation, it is so important to make them feel like they're not alone and make them feel that there's somebody there, and keeping in touch with them through FaceTime, ensuring them that you're going to be there as soon as they get out of there, because like we've been talking about throughout this entire panel, is that it's so easy to just deteriorate or have your mental health deteriorate through this pandemic just because you're forced to be isolated from everybody else and all the things around you.
Yeah, so for me, prior to my international life, I resided in Texas, Houston, Texas. And one of my really good friends plays for the volleyball team. And her team, unfortunately, majority of them did get COVID-19. And after finding this out, it was kind of a shock to me because I was like, I knew it was a thing, but I never really knew anyone that had it. And when she told me, I would check up with her daily. I'd call her and I'd make sure she's okay. And I think honestly, she was telling me because I told her, I asked her afterwards, how was it? Like, were you okay? And she was like, yeah, the best thing about it was people just checking up on me. It just showed how many people care. And I think that's really what boosted her morale to push through.
Yeah, I don't know anyone personally in my family or among my friends that got COVID-19, but over the course of the pandemic, I've had to visit a couple of my elderly relatives, and you know that like when you visit someone that's older, the risk of them getting COVID and is much higher, and it's a lot more dangerous for them too. So I think one thing that I kind of had to do was isolate even more when I was around them, and for me, that situation was two ways, I guess. Firstly, it kind of added this extra depth to an already quarantined life and an already quarantined situation where at one point, instead of not being able to go outside of like a house, for example, you couldn't even go in a couple of rooms. And that kind of, it hurts and it makes you frustrated. But I guess like someone Shayan said, keeping in contact with the people that might be victim to it, or keeping in touch with them and just making sure that they have your full support and that they know that you're there for them is the biggest thing, I'd say.
Yeah, I haven't known anyone personally within this time period, but I have worked as an EMT and have had to deal with many people that did have COVID. And even though we'd be all gowned up and all that when we're around them, it's definitely interesting because I had one patient that like asked me like, he's like, thanks for like being around me. Like he was just kind of like, I don't know, like he was nervous that I was going to treat him differently because he had it versus like a different patient. So like when you're in the healthcare field, it's definitely important to like make sure you're not treating that patient like they're someone that like is like weird, like it's just like important to make them feel validated and make them feel like they're still like heard even if they like have COVID.
Yeah, I definitely agree. I think it's important to make sure like we explain to everyone like their value and their contribution matters. I've certainly learned a lot speaking to you guys about mental health. I hope others have too. Thank you all for joining us and contributing, and a big thank you for our audience as well to listening to this panel. I appreciate you guys taking the time to be here. Thank you, and we'll see you next time.
Thank you.
Thank you, guys.